Welcome back to Good Day Chicago. So this week we've been reporting that the CDC is set to vote on the hepatitis B vaccine for newborn babies. Typically they get the first shot before they even leave the hospital. So the CDC is going to determine if they still want to offer that type of recommendation. We want to bring in pediatrician Dr. David Stiasny with Endeavor Health to answer some questions about this. Doctor, thanks for joining us.
Thanks for having me, Natalie.
Sure. So let's talk first about this vaccine in and of itself. How many doses do kids usually get, and when should they get them?
Sure. So kids typically get 3 doses over a period of 6 months. And it's the same way even in adults as well who have not had the vaccination. Typical vaccination is 3 doses over 6 months. The dose usually happens at birth, and then 1 to 2 months of age, and again at 6 months.
What is the risk of hepatitis B for newborn babies?
Sure. I mean, if a newborn baby contracts hepatitis B, most likely it's going to be from birth from mom or even some close household family members. If they get chronic infection as a newborn, they have the risk of having a 90% risk of having chronic infection, which can lead to cirrhosis and liver cancer later in life. It's a much higher risk than even if it was an older child or an adult. About 20 to 50% for older children, only about 5 to 10% for adults if they contract it. So much higher risk.
How is Hep B transmitted?
So typically for babies, it's usually transmitted from mom to baby, but it can also be transmitted through open sores on a family member giving a baby a kiss. But also the most common ways typically are through blood exposure or through needles or through other bodily fluids that are not saliva.
Is it true that someone can have hepatitis B, let's say the mother of the child, and not know that they have it?
Definitely. Women usually get tested early on in their pregnancy, and sometimes they test negative, but if they contract the virus later on in their pregnancy, they might not know up until the time that they get delivered because it's tested so early. And sometimes the testing can be delayed where the antibodies don't show up until later on. But also it can be an indolent infection for many, many years. And some people will never know that they have it until they start having liver complications later in life.
What is the recommendation currently? You were saying that I'm going to backtrack here. I think I just already asked you that question, so I'm going to change my line of questioning here. Is it okay for parents to wait to get their children vaccinated?
I wouldn't usually recommend it just because of the fact that sometimes, like I said, the mom's test can be falsely negative or can be delayed antibodies. And I would usually recommend it just because of the risk of chronic infection. If a baby gets hepatitis B, is just so high and puts them at such high risk of morbidity and mortality that we would just say it's best to get the baby early on. Since the hepatitis B vaccine was initiated back in 1991, we have seen a 99% reduction in chronic hepatitis B infection in babies. It went from about 20,000 cases a year to about 200. And so it's a very effective vaccine, very safe.
And that was my last question for you here. Obviously, there's the potential for some risk that's assumed, and that's why the CDC is taking up this issue yet again. Is there a risk for babies that get the vaccine, even a small percentage?
I mean, as with any vaccine, there's always a risk of localized pain, fever, very, very low risk of allergic reactions, somewhere in the neighborhood of like 1 in more than a million. So the risk of waiting and the risk of chronic infection is just so high that I would not recommend waiting. And for all my patients, it's something I do talk about regularly, that they should get that dose while they're in the hospital. It's the most effective at that time.
Thank you so much. I think you've provided a good amount of information, some that I have not heard before. So thank you so much, Dr. Stiasny, for joining us this morning. Have a great holiday season.